for a safe space where healing might take place, where everyone is valued. Given tools to maintain where equity matters. Less talk, more action, where anyone is welcome. Don't send them home packing, this is strong talk. When conversation pops off, speak life, reflect hope, promote choice and love folk. Strong talk, real talk, no jokes. Recovery, culture, community. Let's go.
Hello and welcome to Strong Talk, a podcast dedicated to the discussion of equity, diversity, and family as it relates to mental health and addictions. A space not only to talk about challenges, but to explore and to create space for solutions. I'm your host, Vic Armstrong, and I want to thank you all for joining me on this journey. I'm joined today by Angela Weeks. Angela is Project Director for the Center for Excellence on LGBTQ+ Behavioral Health Equity, which is housed at the Innovations Institute at the University of Connecticut. Welcome, Angela.
Thanks for having me.
Thank you so much for being our guest today. So that's a mouthful when I give you a title. Tell us a little bit about what that means. What do you do?
Sure. Yeah. So I'll start with the Innovations Institute. So Innovations Institute is at the University of Connecticut School of Social Work, and it is really focused on the translation of research to practice. So helping providers across the country, across different systems of care, implement things that are evidence-informed, evidence-based, help them figuring out, organizational change initiatives, how to serve different populations in better evidence-informed ways. And so within Innovations Institute, we have a national SOGI center that does the same thing, but is focused on sexual orientation, gender identity, and expression. And so again, sort of across systems of care, we're helping people implement best practices and translate evidence to practice. And then part of that work is the Center of Excellence on LGBTQ plus behavioral health equity. And this is a center funded by SAMHSA to provide this sort of support for behavioral health providers.
Like I said before, that's a lot. So can you talk a little bit about the unique challenges as it pertains to behavioral health? What are some of the unique challenges that the LGBTQ plus community faces? Because, a layperson might wonder, why do you need a special center to focus on equity in that space?
Yeah, and I think a lot of people do wonder that. We get a lot of questions about why would we have such a focus, a national center and also a center of excellence focused on this population. And I think, sort of really broadly, this population experiences negative health outcomes and negative quality of life outcomes across every identity within the LGBTQ community. So lesbian, gay, bisexual, transgender, questioning. There's intersex populations, folks that identify as asexual, and many other identities that aren't represented in the acronym. But each of these populations still has really high disparities when we look at numbers like symptoms around depression, anxiety, suicidal thoughts or attempts, as well as quality of life outcomes, such as performance in school, involvement in the criminal justice system, experiencing homelessness, involvement in the child welfare system, poverty. And so it's really important to look at what all those folks within the community are experiencing to answer questions around why. And some of the things that, the really big buckets as to why folks are experiencing these types of disparities really comes down to the discrimination and stigma they experience in schools, in their own homes, if their families are not supportive. We still hear of LGBTQ people being fired or denied jobs because of their identities, denied housing. And as you can imagine right now, if you've been paying attention to sort of what's happening on a national, in the national climate around LGBTQ people, there are a lot of laws that are being passed that restrict access to gender affirming care for trans people. So all of this stuff adds up, right? It causes so much stress for the population and then contributes to the numbers that we see.
So one of the things I think for me that as I think about, because you talk about a lot of different challenges that people can face, and I know that like I do a lot of work in the suicide space, And I know that when I have conversations with different communities and different subsets of the community, not everyone comes to the conversation from the same place because of cultural differences. And then oftentimes, if you're talking to adults or kids, it's different. And when you're talking about the LGBTQ plus community, that's a broad community because you are talking about people who come from all cultural, racial, ethnic backgrounds. How are you able to really provide resources in a way that still lets people identify not only with their sexual orientation, gender identity, but also who I am as a Black person or an Asian person or a Hispanic person? How do you balance all that in providing those resources?
Yeah, that's a great question. I think first, we acknowledge that there are quite a few similarities in people's experiences when they identify as anything other than straight and cisgender, right? At a policy level, laws that have been passed, things like being denied access to marriage or adoption for a number of years, the coming out process, those things are very similar across cultures. At least we can assume there's some sort of thread that moves between all of them, that helps us make resources relevant to large populations. But one of the things that we really um, are proud of is really leaning sort of on communities to inform us about what they're experiencing and how we can help. So we have a really large consultant pool of people with lived experience, families, young people, older adults that identify as LGBTQ. We have lots of people who are also part of that consultant pool that do research on populations in very, very specific ways. For example, we have someone who does research specifically on Black men who identify as bisexual, to help us understand what are some of the disparities really specific to that intersection of identities. And so we lean on these consultants across the country to really tell us what they're experiencing in behavioral health, how we might be able to help, what they would like behavioral health providers to know. And so without that lived experience, we wouldn't be able to provide the quality and accuracy of resources we're able to.
Mm-hmm.
And then the other thing I would say is that everything that we create is done with people of color in mind. And so we do a lot of systems work, like I mentioned before, in child welfare, behavioral health, and also looking at the justice system. And across all of those, we see disparities around race, right?
Mm-hmm.
And so we really can't go wrong if we're trying to create resources for the Black and brown folks that are LGBTQ that are experiencing these systems, people that have migrated over into the US, or people who don't speak English, for example. Like that's where we get, I think, a lot of, it feels like we make a bigger impact there because we're filling gaps where previously there were no resources.
And how do you, as you build out those resources, because it would seem that you would be almost in a constant state of just expanding your base of resources and bringing on new and innovative practices. How do you do that? Because you mentioned earlier about evidence-based and evidence-informed practices. How do you do that? Also making sure that you're including the voice of lived experience as you're rolling these products out.
Yeah, that's another great question. I think that thinking about evidence-based programs and research, we have to acknowledge sort of the history of those things,
Yeah.
and the impact they've had on lots of different communities. So there's certainly lots of research that's been conducted in ways that were harmful to communities of
Mm-hmm.
color, to LGBTQ people, to families who were living through poverty. Understanding that history and where that was rooted in is really important for us. And also acknowledging that lived experience is a form of evidence, right? And if someone is coming and telling me their lived experience, that's their truth, that happened, right? I acknowledge and hold space for that. And if we hear it from multiple people and there's a gap in the field for a tool around it, that's where we jump in and say, okay, we can do something.
Yeah.
And so I think that's really important. And also involving communities in the type of research and work that you do is really important.
Yeah.
Even if someone's, creating a survey talking to the community that's intended to be surveyed to ask if it's, are these the right questions? Will these
Mm-hmm.
questions do harm? Will this serve you and your goals as well is really important.
Yeah. There's always that challenge of, having that reliance on evidence-based, evidence-informed, but also making room for community informed. What works in communities that we can build on, and not everything has to be done from the ground up. Sometimes you can find things that are already working and help to support those things. And I can imagine that's probably a big part of what your organization does as well.
Yeah, and we try to do a lot of work around cultural adaptation. So, if there's something like cognitive behavioral therapy or some other evidence-based or informed program that has a good foundation, it's worked well in certain populations, we try to look at those tenets and how might we be able to culturally adapt it for another population.
Yeah.
Because again, when you're working with LGBTQ populations, you can't have an effective intervention if you're not talking about discrimination, the impact of that, minority stress, the coming out process. So that's also where a great opportunity to involve community to think through what would an adaptation look like.
Yeah. The CDC recently came out with their data looking at suicide rates and some of the disproportionate impact on different groups in terms of suicidality, but also anxiety and depression. And of course, one of the groups that they highlight is LGBTQ, especially LGBTQ youth. Can you talk a little bit about some of the challenges around suicidality and what those numbers look like, and the impact on the LGBTQ community?
Yeah, I can. So we have several national studies that have shown that rates of attempted suicide and suicide are extremely high for this population across age groups, right? Because sometimes we only think about youth and we're not really thinking about adults or older adults, but across age groups, it's really high. To give you an idea, there was a national study done in 2016 that showed 40% of transgender adults reporting have made a suicide attempt, and then 92% of those individuals had made the attempt before the age of 25. And 2016 is like rather old data, but I would say that what I've seen across my desk recently is just an increase of that number, especially as bans on restroom access and
Yeah.
sports and gender affirming care rolling out across the country. We've seen those numbers spike. And then we know that among people who identify as bisexual, they're 4 times more likely to report a suicide attempt compared to lesbian and gay individuals. And then lesbians are 2 times more likely to report an attempt compared to those who identify as straight. And then I'll just throw one other number in there. There was a study that found that 44% of Black LGBTQ youth had seriously considered suicide. And then that included 59% of Black transgender and non-binary youth. And that was a 2020 study. So, we know that these numbers are really high. And when we trace back protective factors, like what are the things that are contributing or not contributing to these numbers, we see that family support is a huge one.
Mm-hmm.
Any support actually is huge. There's a study by the Trevor Project that showed having one accepting adult in a young person's life reduced the risk to suicide by 40%. But family support is one of the biggest protective factors. We see that virtually these disparities disappear if the family is always affirming of the LGBTQ young person. So, and if they're not, these numbers obviously increase along with high rates of depression and anxiety, and also like substance misuse, risky sexual behavior. All of those numbers get far worse if families aren't supporting their young person. So one of the things that we really try to emphasize when we're working with providers across the country is don't forget about the family.
Mm-hmm.
So much effort has been put into helping LGBTQ youth become independent, become more resilient, develop coping mechanisms so that they can navigate discrimination. And such little work has been done with supporting and helping families with adopting affirming behaviors. But really, that would be obviously such a tremendous help to so many young people. And then the other thing that we see as contributing to these rates is access to things like name changes. If a young person has access to gender affirming care, including hormone replacement therapy, that makes a big difference, as well as things like school environments.
Yeah.
So in many cases, LGBTQ youth who are not getting support at home are often only getting support at school if there's like a GSA or if they have peers that identify as LGBTQ to lean on. But if the school environment is also not supportive and the home life is not supportive, it becomes a really kind of a state of emergency for that young person.
Yeah. I wonder if you have had any interaction with faith-based organizations, because as I think back on a lot of the work that I do now in the suicide space and trying to work with faith-based organizations have really struggled with suicidality and mental health challenges, period, but have really struggled as it pertains to the LGBTQ population. Does your organization work at all with faith-based organizations, and what does that look like?
So we certainly provide technical assistance to anyone who's providing any sort of support and services in the community, and that would include faith-based communities and organizations. I would say that we've only really worked with a handful, and usually they're reaching out because they want to do something and they're not sure what to do.
Yeah.
But we also we track the faith-based groups and communities that do advertise that they're supportive, and that number grows all the time, which is really important for people to know, especially families and young people and LGBTQ adults. Everyone who wants a connection to faith, right, should know that in every denomination we have been able to track a group that is LGBTQ affirming. There are Catholic dioceses that are, there are temples, there are people within the Muslim faith, and the list just goes on and on. And so when people reach out to us for religious resources, it's not hard to find something to connect them to. And I think that, that's such like hopeful news. We wouldn't have been able to say that, I don't think, like 10 years ago.
Yeah. So do you get the sense that we're making substantial progress in being more accepting and being more supportive of the LGBTQ community?
Yeah, I think we are at a point where we've never had as much research as we have now on the population. We have so much data that shows us really exactly what's going to help and what's going to harm. And we have more funding than we've ever had to provide services to this population. There are more programs that have been developed to serve the population. There's more GSAs at high schools, which are gender and sexuality alliances. There's more faith-based communities stepping out, and more laws explicitly protecting people in certain states. So I say all of this, and there is a lot to celebrate and be happy about. And also we are at a point where if there was previously a standard of discrimination, we're seeing that now that discrimination is getting legislated. And so because of that, we're seeing more explicitly laws that are being passed that will block people access. That we have this year an unprecedented amount of anti-LGBTQ legislation. I think the last tracking I saw was over 500 bills had been proposed. And there is a significant amount of states that have blocked gender affirming care for people under the age of 18, which we know gender affirming care for young people is life-saving. So I think we're at a point where we see so much progress, right? And also we have to stay on our toes because there's also so much that could cause harm.
And a lot of the resources do seem to be geared toward a younger population, and I understand why. The thing we don't often talk about, though, are the needs of elderly people who identify as LGBTQ. Are there unique needs we should be thinking about there? Are there things that we should be doing differently that we're not doing? And what are your thoughts on that?
Yeah, I absolutely. The population of LGBTQ older adults has carries a lot of historical trauma,
Yeah.
right? So they lived through a time where being LGBTQ was criminalized. They definitely lived the majority of their lives without access to marriage, without access to family building, without access to benefits sharing, like your partner's insurance or survivor benefits,
Hmm.
which up until recently, 2021, there were still issues with survivor benefits for LGBTQ older adults that had lost their spouses. They
Yeah.
were not allowed to marry, so many of them struggle um, with poverty and economic instability. So there's that. There's, because they were not able to easily or as easily build a family, many of them are aging with fear of loneliness and isolation and not having anyone around them except for peers their own age that are
Hmm.
equally aging with them. And so there's less support just generally. And
Yeah.
many LGBTQ older adults talk about being afraid of having to go to an assisted living facility where they're not going to be affirmed, where they're not going to be respected around their gender pronouns or any of their sort of needs as an LGBTQ person. So I think those are significant. Um, and I would say too, they lived through the HIV and AIDS epidemic where they were for a good chunk of time totally abandoned by
Yeah.
any service industry or healthcare system or the government to figure out how to solve that issue. And so for many of them, they lived through a period where they were watching their chosen family and their friends and their partners um, die and be
Mhm.
treated in really awful ways. And I think behavioral health providers and people providing like crisis support should understand a little bit of that historical trauma um, because we still hear LGBTQ older adults talk about how impactful that was.
Yeah. Yeah. Wow. So, what advice would you give to someone who may be, either they've come out or they have not, but they're struggling with, their mental health, they're maybe feeling some depression, anxiety, feeling like no one understands, maybe even getting to the point of suicidality. What advice would you give them as far as connecting and reaching out and getting help?
Yeah, I mean, I would want them to reach out to someone right away to get connected to an LGBTQ affirming support and communities. So there's a couple of really great options. Sage is an organization who has been developing materials and advocating for LGBTQ older adults for a very long time. They have their own hotline set up. Um, and folks can call into there, and that's an LGBTQ ran and directed hotline. There's also the Trevor Project that's
Mhm.
LGBTQ youth focused. And so those are two great options. We also know that as 988 is rolling out across the country, many crisis counselors are engaging in training and coaching around LGBTQ identities and would be able to provide support to folks. But really, if it's at a point where someone is feeling hopeless, reaching out. And even before that point, reach out, right?
Yeah.
Just talk to people, get connected to community because connection to community and people who are going to um, uh, understand what you're going through is going to be so helpful in feeling less alone and feeling um, like there is something potentially wrong with you. And then getting connected would be my first thing. And then second, um, I would say that there's nothing wrong with you. You like every LGBTQ person is has a right to be here and every identity is valid and there is nothing unhealthy about them. They are part of the diversity of the human experience. And if
Yeah.
someone is experiencing rejection, it's because that the person who is rejecting them or treating them poorly just doesn't know.
Yeah.
Um, enough about sexual orientation and gender identity, or they may be even struggling with their own internal questioning, right? Things about their lives that have happened, thoughts that they may have had that they've internalized. And so I would just really wish that LGBTQ people would hear that message. I know when I heard that message, it was really life shifting.
That is fantastic. Is there anything that, as we wrap up here, is there anything I have not asked you about that you want to share? Anything you want folks to know about your organization or just in general?
I would say for our organization, we try to be as helpful as possible in providing like a one-stop shop for people. So a lot of agencies or providers may struggle with finding things that are accurate and updated online and centralized, and we can help with that. If you reached out to us and you had a request, we would find you the resources, and if the resources didn't exist, we would create them. So we have everything from free training, we have technical assistance, we have assessments, we have things that you can provide clients, we have things for families and things for youth. And so instead of being overwhelmed by the amount of information online, you can reach out to the National Sochi Center or the Center of Excellence, and we will try to connect you. And then the other thing that I would leave off with too, again, I know I've already said it, but just let's make sure that we're thinking about families and not leaving them behind.
Yeah. Well, Angela, thank you so much for being with us today, and thank you to everyone who tuned in. Just the work that you're doing and your enthusiasm about it gives me hope. So I really appreciate everything that you're doing, and we'll have to have you back again because there's still so much more that I would love to talk to you about. But again, thank you so much, Angela, and thank you for all of our guests for joining us, or all of our audience for joining us today for Strong Talk. One of the catchphrases we've all heard is "speak truth to power." While I would agree with that mindset, I would argue that even more important than speaking truth is being true. Be true to your core values and the principles that guide you. Many of us in the African American community advocate for equality. We advocate for social justice. We advocate for the respect and dignity we are entitled to as a birthright of our humanity. I consider myself an advocate for social justice. It is what drives my passion for spreading awareness about the impact of mental illness and suicide in communities of color. It's what drives me to advocate for reform that addresses disparities in access to care, access to healthy foods, access to housing in socially economically deprived communities. It is also what drives me to advocate for the rights of the LGBTQ community. African Americans continue to experience bias, discrimination, and prejudice throughout our society. The situation is even more severe for African Americans who identify as LGBTQ, who have to deal not only with racism, but homophobia as well. Though I don't know what it's like to navigate life as a member of the LGBTQ community, I do know what it's like to navigate life as a Black man. I know firsthand what it feels like to be discriminated against, judged, even despised simply for being who you are. I know how it feels to be viewed as less than. I know the awkwardness of trying not to make others uncomfortable simply by your presence. I've experienced the burden that people of color often feel to take responsibility for the discomfort, fears, and biases of others. I remind us all that all any of us ask is the freedom to be who we are, whether Black, white, Asian, Hispanic, gay, straight, or trans. We all want to live, love, and be our best selves. Those in the LGBTQ community are no different. We are all human beings, and we all deserve to be respected as such. In the words of the late Dr. Martin Luther King Jr., injustice anywhere is a threat to justice everywhere. And that is Strong Talk.
What's the word? What's the word? Word, strong talk, strong talk. What's the word? What's the word? What's the word? Yeah. What's the word? Strong talk, strong talk.